How will you prevent the scar formation after the surgery? See, it depends on various factors. First major thing is your genetic background. Already you were operated, but that scar is not at all visible. That means even this surgery scar might not be visible, but not all the time. In same way, your ethnicity. The white skin people always have a better scar forming ability, and that darker skin people always have the bad scar forming ability. And other thing, sun exposure. As soon as the surgery, you expose the wound to the sun. Obviously, the pigmentation happens in the region, so that scar won't look good. So, how will you prevent bad scar formation after the surgery? So, first important thing in first 2 to 3 weeks is you should not allow the scar to expand. Meaning, see, we put the suture, still it will be under tension. So, for preventing that, we use something called sterile plasters. Actually, it's called steri-strips. See, example, scar is this way. You have to make the sterile plasters. You have to make it into multiple small pieces. Use it vertically across the scar, 90-degree vertical way. So, if you use that steri-strips for 3 weeks, then you can switch over to the other thing called silicone gel sheet. Silicone gel sheet basically gives a hydration. It won't allow the wound scar to elevate and become a bad scar. So silicone gel sheet, you have to use it for 3 months at least. So 3 weeks steri-strips, 3 months silicone gel sheet. So sometimes 100% silicone available in a roll-on format or a spray format with a SPF in it, sun protection factor in it. So if you have that access to get those kind of materials, it's well and good. You can use 100% silicone, the spray or a roll-on with a SPF in it. Usually it is available in international areas, not in the Indian subcontinent. So when you are using the sterile plasters, you have to understand that it should not be over the area where it is not healed. So check the suture line. Where it is completely healed, use the steri-strip. Maybe some areas might not close, some mild dry area will be there. Those areas, don't use the steri-strips. Apply the epidermal growth factor ointments are available. So those open areas, apply the epidermal growth factor ointments. It comes in various trade names like a Region B and a lot of companies making it. It's the epidermal growth factor. You have to use that. After 3.5 months, basically 3 weeks sterile plaster, 3 months silicone gel sheet. After 3.5 4 months, you still feel the wound is not good. There are a lot of scar creams are available. That scar creams you have to use it for at least 6 months to make the scar look even more better. So these are all the things you need to do to prevent the scar expansion and scar elevation and avoid the pigmentation. Same way you have to prevent the scar from the sun. So if it is a body scar, say example tummy tuck scar or breast scar, completely cover it with thicker dresses and don't go out in the sun as much as possible. If it is the face, try to use an umbrella, try to use a sunscreen as much as possible. If you go out in the sun, blackish brown pigment happens. Sometimes it's difficult to erase the pigment after the pigment formation in the scar area. So understand these things. After 1 year also, you still feel the scar is elevated. There are a lot of lasers are available. We can try the lasers. Sometimes laser can be used early time, provided like it's not a darker skin people. Darker skin people usually the lasers are sometimes double-edged sword. You do it for the better scar, but it becomes even more worse. Some cases. So better to use that very judiciously whenever needed in a selective patients. I hope you understand now how to prevent the scar formation after the surgery. Thank you.